Hey everyone, and welcome to This Explainer. Today, we're going to unpack a truly fascinating, classic inborn error of metabolism that literally changed how the medical world approaches newborn health. We're talking about phenylketonuria, or as it's more commonly known, PKU.
I want you to just think about this for a second. What if a single, tiny missing enzyme in a newborn baby could lead to irreversible brain damage, severe seizures, and profound developmental delay? It's honestly kind of terrifying, right? To consider the outsized, devastating impact that just one microscopic biochemical glitch can have on a human life.
But here's the massive twist. Despite all those incredibly severe risks, this condition is actually one of the absolute most preventable causes of intellectual disability in all of medicine. It's a true medical marvel of how we can intercept a devastating disease before it ever really takes hold.
All right, so here is our roadmap for today. First, we'll cover the single missing enzyme. Second, toxic buildup and brain damage. Third, recognizing clinical symptoms. Fourth, the newborn screening miracle. And finally, treatment and maternal risks.
Okay, let's dive straight into part 1, the single missing enzyme.
Let's get right down to the root cause. PKU is a genetic metabolic disorder. The entire cascade of this disease, the whole shebang, is caused by a deficiency of one very specific enzyme, phenylalanine hydroxylase. Without it, the body simply cannot process an amino acid called phenylalanine. And when you can't process it, you get a dangerous, toxic buildup of it and its metabolites.
To really visualize this, think of it like an assembly line. In normal metabolism, phenylalanine is smoothly converted into another amino acid called tyrosine. That reaction relies entirely on our star enzyme, phenylalanine hydroxylase, along with a crucial little helper molecule, or cofactor, called BH4. But in PKU, that pathway is a brick wall. The factory is completely shut down. Because the enzyme is defective, the phenylalanine has absolutely nowhere to go, so it just relentlessly accumulates.
Which brings us to section 2, toxic buildup and brain damage.
So how does this damage actually happen? It's basically a 3-step domino effect. Step 1, because of that blocked pathway, phenylalanine levels spike wildly, and these high levels are directly toxic to a developing brain. Step 2, since the conversion process is broken, we get a severe drop in tyrosine, and tyrosine is super important. It's a precursor for vital things like melanin, dopamine, and norepinephrine. Which leads to step 3, neurotoxicity. Those toxic phenylalanine levels cause impaired myelination. That's essentially damaging the electrical insulation around our nerves, which directly causes cognitive impairment and developmental delay.
Let's move on to section 3, recognizing clinical symptoms.
This hidden biochemical storm, it doesn't stay hidden for long. It usually becomes highly visible in a newborn after just a few months of life. Without intervention, the clinical threat of untreated PKU is just immense. The neurological fallout is severe. We're talking significant intellectual disability, early onset seizures, serious behavioral problems, and really profound developmental delays. The brain is quite literally under attack by the proteins the baby is consuming.
Now here's a detail that's actually pretty wild. Untreated PKU patients often develop a classic musty or mousy body and urine odor. And no, that's not just a random symptom. It's a direct sensory result of the alternative pathways the body is desperately trying to use. It ends up converting that built-up phenylalanine into a substance called phenylacetate, which carries this distinct, really unforgettable smell. You'll also see some very specific physical traits, particularly hypopigmentation, meaning unusually fair skin and light hair. Remember a minute ago when we mentioned that blocking the pathway reduces tyrosine? Well, tyrosine happens to be the exact precursor to melanin, the pigment that gives color to our hair and skin. So low tyrosine directly equals low melanin, literally altering the child's physical appearance.
Let's shift gears to section 4, the newborn screening miracle.
So, how on earth do we stop these dominoes from falling? The absolute most crucial point of this whole explainer is this simple intervention. The heel prick test. It's a standard newborn screening done all over the world. It specifically hunts for elevated phenylalanine levels and low tyrosine in the blood just days after a baby's born. Finding this early is literally a game changer. If you catch the biochemical defect before the toxic buildup truly takes off, you can completely prevent the brain damage. Period.
Now, quick side note. Not all cases are exactly identical. There are 3 main variations we look out for. Classic PKU is the most severe. That's when there's almost zero enzyme activity. Then there's variant PKU, which means there is at least partial enzyme activity, so the buildup isn't quite as aggressive. And finally, BH4 deficiency. In this case, the enzyme itself is actually fine, but that essential cofactor it needs to run the machine is defective.
And that brings us to Section 5, treatment and maternal risks. Once we've detected it, what's our lifelong game plan? It's elegantly simple. Restrict the intake of phenylalanine. That means strictly cutting out high-protein foods. We're talking meat, eggs, and dairy. Instead, patients rely on allowed foods, specifically special low-protein formulas, and really tightly controlled amino acid intake. This ensures they get the nutrition they need to grow, just without all the toxicity.
But because that body's conversion factory is broken, we can't just take away the bad stuff, we also have to supply the good stuff. Tyrosine actually becomes an essential amino acid for these patients, meaning it requires heavy supplementation. And in those cases involving the cofactor defect we just talked about, we also use a drug called sapropterin. It acts as a BH4 replacement therapy to help jumpstart whatever enzyme function is left.
Okay, we absolutely have to touch on a massive, high-yield concept later in life known as maternal PKU. If a pregnant woman who has PKU does not strictly control her diet, her excessively high phenylalanine levels will cross the placenta. This acts as a direct, toxic threat to the developing fetus, leading to microcephaly, severe fetal brain damage, and congenital heart defects. And this happens even if the baby doesn't genetically inherit the PKU condition itself.
Let's do a rapid-fire review to really lock these pearls in. The defective enzyme, phenylalanine hydroxylase. The accumulated toxic substance, phenylalanine. The deficient downstream product, tyrosine. The classic odor you need to watch out for, that musty, mousy urine smell. And the absolute most important method of prevention, early newborn screening.
I want to wrap up with this incredibly powerful truth. With early newborn screening and dietary management, affected individuals can live normal, healthy lives. Honestly, it is a profound testament to modern medicine. Just identifying and understanding a microscopic metabolic pathway can quite literally save a child's mind and secure their entire future.
So, having seen all this biochemistry in action, I've got to ask you, which inborn error of metabolism should we unpack and explore next? Let us know. Keep learning, and I'll see you in the next explainer.